Hello, everyone, and welcome back to the Insight Room, where we understand the mind one insight at a time. Today, we are talking about 4 terms that get used constantly online, in true crime content, in relationship videos, in clinical conversations, and in everyday arguments: antisocial personality disorder, psychopathy, sociopathy, and narcissistic personality disorder. And very often, people use these terms as if they all mean the same thing. Someone lies and manipulates people, and they're called a psychopath. Someone is cruel in a relationship, and they're called a sociopath. Someone is selfish or arrogant, and they're called a narcissist. Someone breaks the law or harms others, and people assume that they must have antisocial personality disorder. But clinically, these terms are not interchangeable. Some of them are formal diagnoses. Some are research or forensic constructs. Some are informal labels. And some are used so loosely online that they sometimes create more confusion than clarity. So in this video, I want to walk through the differences between ASPD, psychopathy, sociopathy, and narcissistic personality disorder. Not just at a surface level, but across multiple domains: behavior, emotional style, empathy, remorse, relationship rules, interpersonal patterns, motivation, aggression, attachment, self-image, manipulation, accountability, developmental history, and common public misuses. The goal is not to give you a tool to diagnose your ex, your parent, your boss, or someone you saw in a documentary. The goal is to clarify what these terms actually mean, where they overlap, where they differ, and why using them accurately matters. So before we get into it, a quick disclaimer. This video is for educational and entertainment purposes only. It is not a substitute for mental health treatment, psychological assessment, psychiatric diagnosis, or legal consultation. Personality disorders and personality traits should not be diagnosed casually from one behavior, one relationship, one argument, or one social media post. Also, these terms can be stigmatizing. Personality disorders are not insults. They are clinical descriptions of enduring patterns that may cause distress, impairment, or harm. At the same time, avoiding stigma does not mean minimizing harmful behavior. Some patterns are exploitative, abusive, dangerous, or severely damaging. The goal is to describe those patterns accurately rather than using labels loosely. Let's start with the simplest distinction. Antisocial personality disorder, or ASPD, is a formal diagnosis. It involves a pervasive pattern of disregard for and violation of rights of others. Diagnostic descriptions commonly emphasize behaviors like deceitfulness, impulsivity, irritability or aggression, reckless disregard for safety, consistent irresponsibility, and lack of remorse. The person must be at least 18 years old, and they must have evidence of conduct disorder before the age of 15. Narcissistic personality disorder, or NPD, is also a formal diagnosis. It is generally characterized by grandiosity, need for admiration, lack of empathy, entitlement, and a heightened sense of self-importance. Is different. Psychopathy is not a standalone DSM diagnosis. It is more often discussed as a forensic, research, or personality construct. The Hare's Psychopathy Checklist Revised, or PCLR, is one well-known assessment tool used in forensic and research settings. Psychopathy is commonly discussed in terms of interpersonal, affective, lifestyle, and antisocial features. And sociopathy is the least precise of the 4. Sociopathy is not a formal clinical diagnosis. It is usually a colloquial term people use to describe antisocial, manipulative, exploitative, volatile, or chronically harmful behavior. But because it does not have one agreed upon clinical definition, the meaning changes depending on who's using it. So the simplified version of this is ASPD is a formal diagnosis focused heavily on a repeated pattern of violating others' rights. Psychopathy is a trait construct involving callousness, manipulation, shallow affect, low remorse, and often antisocial behavior. Sociopathy is an informal label with inconsistent meaning. NPD is a formal diagnosis centered around grandiosity, entitlement, admiration, shame regulation, and impaired empathy. That's the basic map. Now let's get a little bit deeper. When we look at typical behavior, ASPD is usually the most behaviorally defined of the four. With antisocial personality disorder, we're looking at a long-standing pattern of behavior that may include deceitfulness, impulsivity, aggression, irresponsibility, reckless disregard for safety, violation of others' rights, and lack of remorse. So, for example, this might be someone who repeatedly lies, exploits others financially, gets into fights, ignores obligations, and then blames people they harmed for being weak, gullible, or overly sensitive. The important part is not one isolated behavior, it is the pattern. A person lying once does not mean ASPD. A person being irresponsible in one season of life does not mean ASPD. ASPD is about a pervasive and enduring pattern of violating rights, norms, safety, and responsibility. With psychopathy, the behavioral pattern can overlap with ASPD, but psychopathy is broader than just behavior. It often includes superficial charm, manipulation, callousness, shallow emotional expression, low remorse, stimulation seeking, and often antisocial behavior. For example, someone with strong psychopathic traits may calmly deceive multiple people for personal gain while appearing charming, composed, and socially confident. They may not seem impulsively out of control. They may seem strategic, smooth, and emotionally detached. With sociopathy, we have to be more careful because this is not a formal diagnosis. People often use the term to describe chronic lying, manipulation, emotional volatility, irresponsibility, aggression, or harmful behavior. For example, someone might describe an ex as a sociopath because the person was explosive, deceitful, or emotionally harmful. But clinically, that label does not tell us enough. It could refer to antisocial traits. It could refer to trauma-related behavior. It could refer to substance-related behavior. It could refer to emotional dysregulation, or it could simply be a hurt person using a label for someone that harmed them. With narcissistic personality disorder, the typical behavioral features are different. NPD is more about grandiosity, entitlement, admiration seeking, envy, arrogance, exploitation, sensitivity to criticism, and impaired empathy. For example, someone with narcissistic features might demand special treatment, dismiss other people's needs, exaggerate achievements, expect constant praise, and become angry or contemptuous when they're not admired. The key distinction is that ASPD is more centrally about violating rights and norms. Psychopathy adds a callous, manipulative, emotionally shallow trait profile. Sociopathy is informal and inconsistent. NPD is more about grandiosity, entitlement, validation, and self-esteem regulation. Chapter 2. Emotional Style. Now, let's talk about emotional style. With ASPD, the emotional style can vary. Some people may appear irritable, reactive, impulsive, easily angered, or indifferent to consequences. Others may seem emotionally detached or unconcerned. For example, after hurting someone, the person may focus almost entirely on how the consequences are unfair to them. Instead of saying, I hurt that person, they may say, now everyone is against me, or they're trying to ruin my life. With psychopathy, the emotional style is often described as more shallow, cold, detached, low fear, or composed. That does not mean the person has no emotion at all. It means the emotional depth, emotional resonance, fear response, or guilt response may be reduced or atypical. For example, a person with strong psychopathic traits might discuss a serious betrayal, manipulation, or act of harm with very little visible anxiety, guilt, sadness, or emotional conflict. They might understand what happened cognitively, but not seem emotionally moved by it. With sociopathy, because the term's informal, people often use it to describe a more reactive or volatile emotional presentation. In pop psychology, sociopathy is sometimes contrasted with psychopathy by saying sociopaths are more impulsive and emotionally reactive, while psychopaths are more cold and calculated. But that distinction is not a clean clinical rule. For example, someone labeled sociopathic may alternate between intense attachment, rage, impulsive threats, and manipulative apologies. But again, that pattern could reflect many different clinical possibilities. With NPD, the emotional style is often organized around shame, humiliation, admiration, envy, status, and criticism. Someone may appear confident, superior, or self-assured on the outside, but become intensely reactive when they feel embarrassed, exposed, rejected, criticized, or not treated as special. For example, a person may seem charismatic and confident in public, but become enraged or contemptuous after being corrected in front of others. So, emotionally, ASPD may be reactive, indifferent, or consequence-focused. Psychopathy is often associated with shallow affect and emotional detachment. Sociopathy is commonly used for volatile or reactive behavior, but imprecisely. NPD is often emotionally reactive around shame, status, admiration, and personal feelings of injury. Chapter 3. Empathy Profile. Empathy is one of the most misunderstood parts of this conversation. People often say they have no empathy, but empathy is not one single thing. There is cognitive empathy, which is the ability to understand what someone else is feeling, and there is affective empathy, which is the ability to emotionally resonate with what someone else is feeling. And there is compassionate empathy, which is the motivation to respond with care. Those are not always equally impaired. With ASPD, empathy may be impaired in the sense that the person shows reduced concern for other people's rights, safety, or suffering, especially when personal gain is involved. For example, a person might steal from a family member and rationalize it by saying they had enough money anyways, or they should have protected their account better. The issue is not necessarily that they cannot intellectually understand the harm. It may be the harm just does not inhibit the hate behavior. With psychopathy, empathy deficits are often discussed more specifically in terms of affective empathy. A person may be able to read emotions very well, but not emotionally resonate with the distress they're perceiving. For example, someone may accurately identify another person's insecurity, fear, loneliness, or longing for approval, and then use that information to manipulate them. That is cognitive empathy being used without compassionate empathy. With sociopathy, people often use the term to imply low empathy, but because it is not clinically defined, we cannot be precise. Someone might appear caring toward a few selected people, but show repeated disregard for others outside of their immediate circle. For example, a person may be protective of one family member but exploit, threaten, or deceive others without apparent concern. With NPD, empathy can be complicated. Some individuals with narcissistic traits may have intact cognitive empathy. They may understand what others feel, but affective empathy and compassionate responsiveness may become impaired when their self-esteem, image, status, or sense of superiority is threatened. For example, a person may understand that their partner is hurt, but quickly shift focus to other partners' feelings make them look bad. Instead of responding with care, they become defensive, ashamed, contemptuous, or self-protective. So empathy is not just present or absent. ASPD may involve disregard for others' rights and suffering. Psychopathy may involve reduced affective resonance with others' distress. Sociopathy is an imprecise label, and NPD often involves empathy disruption around shame, entitlement, and self-esteem threat. Chapter 4. Remorse and Guilt. Now, let's look at remorse and guilt. With ASPD, lack of remorse is diagnostically important. This may show up as indifference, rationalization, blaming the victim, or minimizing the harm. For example, someone might say, they deserve it. It was not that big of a deal. They should have known better, or I only did what I had to do. The key is that person does not appear to experience sustained accountability or concern about the harm they caused. With psychopathy, low guilt and low remorse are often central features, but the person may still be very good at performing remorse when it is useful to them. For example, someone may offer a polished, articulate apology because it reduces consequences, repairs their image, or helps them regain some sense of control, but the apology does not reflect genuine emotional concern. With sociopathy, people often assume the person has limited remorse, but again, the term's inconsistent. In some popular uses, the person may show remorse in bursts, especially after an emotional outburst, but the remorse does not translate into sustained behavioral change. For example, someone may cry, apologize intensely, promise to change, and then repeat the same harmful behavior within the next week. With NPD, remorse may be present, but is often complicated by shame, defensiveness, entitlement, and self-justification. A narcissistic person may feel bad, but that feeling may quickly convert into humiliation, anger, or blame. For example, they might say, "I'm sorry you felt hurt, but you embarrassed me first," or "I would not have acted that way if you had respected me." So in ASPD, we often see indifference or rationalization. In psychopathy, remorse may be shallow, absent, or strategically performed. In sociopathy, the term's too vague to define remorse clearly. In NPD, remorse may be blocked or distorted by shame and defensiveness. Chapter 5. Relationship to rules and laws. This is one of the clearest areas of difference. With ASPD, repeated rule-breaking, unlawful behavior, or violation of social norms is central. This does not mean every person with ASPD has the same criminal history, but the diagnostic picture emphasizes behavior that violates rules, rights, and responsibilities. For example, repeated arrests, fraud, reckless driving, physical aggression, chronic deceit, or exploitation despite consequences may fit this broader pattern. With psychopathy, antisocial behavior may be present, but psychopathy is not just criminality. A person can have psychopathic traits and avoid detection, maintain employment, or function in certain environments while still being highly exploitive or callous. For example, someone may never be arrested, but may repeatedly manipulate colleagues, romantic partners, or vulnerable people for personal benefit. With sociopathy, the term's often used when people perceive chronic disregard for rules or norms, but because it's informal, it does not tell us whether the person meets criteria for ASPD, has psychopathic traits, or has something else going on. For example, someone may call a person a sociopathic because they repeatedly break the rules and seem unconcerned about the impact on others, but that label does not clarify the clinical picture. With NPD, the relationship to rules is different. A person with narcissistic traits may follow rules when the rules serve their image, status, or advantage, but they may expect exceptions when entitlement is high. For example, they may believe ordinary procedures should not apply to them because they are more important, more talented, more victimized, or more deserving than others. So ASPD has the strongest connection to repeated rule breaking and rights violation. Psychopathy can include rule breaking, but it's broader than criminal behavior. Sociopathy is a loose label, and NPD may involve rule bending when entitlement and specialness are effective. Chapter 6, Interpersonal Style. Now, let's look at how these patterns show up interpersonally. With ASPD, the interpersonal style may be exploitive, unreliable, aggressive, deceitful, irresponsible, or coercive. For example, someone may borrow money repeatedly, lie about repayment, become hostile when confronted about it, and then disappear or blame the other person for trusting them. With psychopathy, the interpersonal style may be more charming, calculated, dominant, manipulative, predatory, or emotionally detached. For example, someone may build trust very quickly, mirror another person's values, create a false sense of intimacy, and then use that trust instrumentally. With sociopathy, people often use the term for someone who seems manipulative, hostile, unstable, volatile, or unreliable. For example, a relationship might begin with intense charm and closeness, then shift into erratic betrayal, blame shifting, rage, and control. Again, sociopathy does not give us a precise clinical explanation for that pattern. With NPD, the interpersonal style is often revolving around admiration, status, validation, control, envy, and entitlement. For example, someone may treat others warmly when they feel admired, but become cold, dismissive, contemptuous, or punitive when they are not the center of attention. The difference here is important. ASPD is often exploitative and rule violating. Psychopathy may be more calculated and emotionally detached. Sociopathy is an informal label often used for volatile harm. NPD is organized around admiration, superiority, status, and self-esteem regulation. Chapter 7, Motivation. Now, let's talk about motivation. With ASPD, motivation may include immediate gratification, power, money, control, stimulation, avoidance of responsibility, or disregard for consequences. For example, a person may deceive someone because it is easier than working, waiting, negotiating, or being accountable. With psychopathy, motivation often includes dominance, instrumental gain, stimulation, control, and sometimes predatory exploitation. For example, someone might manipulate another person not because they're emotionally desperate, but because it is useful, profitable entertainment, or gives them a sense of power. With sociopathy, there's no formal motivation model. People often use the term when they think someone's behavior is driven by resentment, anger, impulsivity, trauma, or antisocial adaptation. Someone may retaliate impulsively after feeling disrespected, then later justify the behavior as self-protection. With NPD, motivation is often connected to self-esteem regulation. This may include admiration, superiority, validation, status, specialness, and avoidance of shame. For example, someone may exaggerate achievements, name drop, dominate conversations, or devalue others in order to maintain a sense of being exceptional. A simple way to say this is ASPD may be driven by gain, control, stimulation, or disregard for consequences. Psychopathy may be driven by dominance, exploitation, and instrumental benefit. Sociopathy is too loosely defined to have one clear motivational pattern. NPD is often driven by admiration, status, superiority, and shame regulation. Chapter 8, Planning Style. Planning style is another useful distinction. With ASPD, behavior can be impulsive, opportunistic, poorly planned, or reactive. That does not mean every person with ASPD is disorganized. Some can be very calculated. The diagnosis itself, though, includes patterns like impulsivity and irresponsibility. For example, someone may commit fraud, steal, or lash out without fully considering the long-term consequences. With psychopathy, especially in classic descriptions, the planning style is often more calculated, strategic, and instrumental. A person may carefully cultivate several relationships for future financial, sexual, social, or occupational benefit. They may appear patient when patience serves the manipulation. With sociopathy, pop psychology often portrays sociopathy as more impulsive or emotionally driven than psychopathy. But that is not a validated diagnostic distinction in the way people often present it. For example, someone described as sociopathic may make threats, impulsive decisions, or destructive choices during anger, then attempt to repair the damage when consequences appear. With NPD, planning can be strategic when image, status, or admiration are involved, but behavior may become impulsive when narcissistic injury is triggered. For example, a person may publicly attack someone who criticized them, even though the attack damages their reputation, because in that moment, protecting pride feels more urgent than long-term strategy. So, ASPD can be impulsive or opportunistic. Psychopathy is often more calculated. Sociopathy is popularly associated with emotional impulsivity, but imprecisely. NPD may be strategic around image, but reactive around shame. Chapter 9, Aggression Pattern. Aggression can look different across these categories. With ASPD, aggression may be reactive, instrumental, intimidating, or part of a broader pattern of conflict and rights violations. For example, someone may escalate quickly into threats or fights when frustrated, challenged, or blocked from getting what they want. With psychopathy, aggression is often discussed as more instrumental or goal-directed, though reactive aggression can also occur. For example, someone may use intimidation calmly to obtain compliance, silence a victim, or maintain control. The aggression may not look emotionally explosive, it may look controlled, precise, and purposeful. With sociopathy, people often use the term when aggression seems more emotionally explosive, unstable, or reactive. For example, someone may have an angry outburst after perceived betrayal, rejection, or disrespect. But again, this does not tell us what the actual clinical diagnosis would be. With NPD, aggression often emerges after narcissistic injury. That means the person feels humiliated, criticized, exposed, rejected, envied, or disrespected. For example, someone may retaliate against the person that made them feel inferior, even if the original criticism was mild. The aggression is often connected to restoring superiority or defending against shame. So, ASPD aggression may be reactive or instrumental. Psychopathy may involve more predatory or goal-directed aggression. Sociopathy is often used for volatile aggression. NPD aggression is often tied to narcissistic injury, shame, envy, or perceived disrespect. Chapter 10. Attachment and interpersonal bonding. Attachment is important because many people assume these conditions mean the person is incapable of relationships. That is too simplistic. With ASPD, relationships may be unstable, exploitative, conflictual, responsibility avoidant, or marked by repeated betrayal. For example, someone may repeatedly abandon obligations to partners, children, employers, or friends, especially when those obligations interfere with immediate desires. With psychopathy, relationships may be more shallow, instrumental, or emotionally detached. For example, a person may maintain relationships primarily for access, status, money, sex, protection, convenience, or social cover. They may understand the role of closeness without experiencing emotional bonding in the typical way. With sociopathy, people often describe someone as capable of bonding with a few people, but harmful, volatile, or exploitative toward others. However, this is not a formal clinical distinction. For example, someone may appear loyal to one person or one group while being exploitative, aggressive, or callous towards everyone outside that circle. With NPD, attachment often revolves around admiration, mirroring, control, idealization, devaluation, and fear of inadequacy or shame. For example, a person may idealize a partner who admires them, then devalue that same partner after criticism, disappointment, or loss of idealization. In other words, ASPD relationships may be unstable and exploitative. Psychopathy may involve shallow or instrumental attachment. Sociopathy is a loose label often used for unstable, harmful bonding. NPD relationships often involve admiration, idealization, devaluation, shame, and status. Chapter 11. Self-image. Self-image is one of the clearest distinctions between ASPD and NPD. With ASPD, self-image may vary. Some people may be indifferent, inflated, defensive, identity diffuse, or organized around power, autonomy, and not being controlled. For example, someone may think, I do what I want. Other people are weak if they let themselves get used. The self-image may not necessarily be about being adored or admired. It may be more about power, autonomy, toughness, control, or indifference to rules. With psychopathy, self-image is often described as confident, dominant, grandiose, fearless, or emotionally detached. For example, someone may see themselves as smarter than other people and therefore justified in exploiting them. They may view others as tools, obstacles, or entertainment. With sociopathy, there is no consistent self-image profile because the term is not clinically precise. For example, someone labeled sociopathic may present as angry, alienated, victimized, superior, unstable, detached, or resentful. The label itself does not tell us which one is true. With NPD, self-image is central. NPD is heavily organized around grandiosity or vulnerability. superiority or shame, and specialness or inadequacy. For example, someone may need to be seen as exceptional in order to avoid feeling worthless. Their self-esteem may depend heavily on admiration, achievement, appearance, status, or being associated with important people. This is a key distinction. NPD is often about regulating self-worth. ASPD is more about disregard for others' rights and norms. Psychopathy is more about callous, manipulative, low remorse traits. Sociopathy is not specific enough to define self-image clearly. Chapter 12. Response to criticism. How someone responds to criticism can be very revealing. With ASPD, criticism may be met with anger, contempt, intimidation, retaliation, or indifference. For example, if confronted about harmful behavior, the person may threaten the other person, mock them, deny everything, or frame the confrontation as disrespect. With psychopathy, the response may be colder and more calculated. The person may respond with contempt, strategic retaliation, impression management, or calm manipulation. For example, rather than appearing visibly hurt, they may quietly discredit the critic, gather information to use later, or charm other people into taking their side. With sociopathy, people often use the term when the response to criticism is reactive, angry, defensive, or hostile. For example, someone may explode when accused of lying, then quickly reframe themselves as the victim. With NPD, criticism is often especially activating because it threatens self-image. The person may experience criticism as humiliation, rejection, disrespect, or exposure. For example, a mild correction may lead to rage, withdrawal, contempt, defensiveness, or counterattack. The reaction may seem disproportionate because the criticism is not experienced as information, it is experienced as injury. So, ASPD may respond with aggression or disregard. Psychopathy may respond with cold strategy. Sociopathy is often used for explosive defensiveness. NPD is especially sensitive to criticism because criticism threatens self-esteem and status. Chapter 13. Manipulation style. Manipulation is another area where people often lump everything together. With ASPD, manipulation may be deceitful, coercive, opportunistic, intimidating, or exploitative. For example, someone may lie to obtain money, sex, housing, protection from consequences, or access to someone else's resources. With psychopathy, manipulation may be more calculated, charming, predatory, emotionally detached, and strategic. For example, a person may study what someone wants to hear, mirror it back to them, create trust, and then use that trust to gain control or benefit. With sociopathy, the term is often used for manipulation that seems erratic, emotional, volatile, or unstable. For example, someone may alternate between threats, guilt, charm, apologies, and victimhood to regain control after a conflict. With NPD, manipulation often serves admiration, validation, image protection, control, superiority, or avoidance of shame. For example, someone may guilt trip a partner for not being sufficiently appreciative, loyal, admiring, or available. The manipulation is often organized around the idea that the other person has failed to provide the admiration or deference the narcissistic person believes they deserve. The difference is that ASPD manipulation may be more directly exploitative or coercive. Psychopathic manipulation may be more calculated and detached. Sociopathy is an inconsistent label often used for chaotic manipulation. NPD manipulation is often tied to admiration, shame, entitlement, and control. Chapter 14. Insight and Accountability. Now let's talk about insight and accountability. With ASPD, insight and accountability may be limited. A person may minimize, rationalize, externalize, or blame others. For example, they may say, "I would not have done that if they had not disrespected me," or "they were asking for it," or "everyone does it, I just got caught." The issue is not only that they deny behavior. Sometimes they admit the behavior, but they do not emotionally take responsibility for the harm. With psychopathy, a person may intellectually understand consequences very well, but lack emotional accountability. For example, they may give a convincing explanation of what happened, describe the victim's perspective accurately, and still show no genuine remorse. They may understand accountability as performance, not as a moral or emotional process. With sociopathy, again, we do not have a formal clinical definition here, but people often use the term for someone who is often blame shifting, admits wrongdoing inconsistently, or cycles between apologies and repeated harm. For example, someone may briefly admit they were wrong, then later claim everyone else caused the problem. With NPD, insight may be limited by shame avoidance, defensiveness, entitlement, and egocentric beliefs. Egocentric means the person experiences their thoughts, behaviors, or attitude as justified or consistent with who they are. For example, someone may say, I only acted that way because people failed to appreciate me, or I would not have been cruel if they had not made me feel disrespected. The distinction here is important. ASPD may externalize responsibility. Psychopathy may understand responsibility without emotional remorse. Sociopathy is too undefined to be clinically precise. NPD, a struggle with accountability because accountability can trigger shame, injury, and defensive self-protection. Chapter 15, Developmental History. Developmental history matters because these patterns do not appear out of nowhere in adulthood. With ASPD, the developmental requirement is especially important. ASPD requires individual to be at least 18 and to have evidence of conduct disorder before age 15. This is one reason you cannot diagnose ASPD just because an adult is cruel, manipulative, or irresponsible. There has to be a broader developmental pattern. For example, the history may include aggression, deceitfulness, theft, serious rule violations, cruelty, truancy, or repeated disregard for others beginning in childhood or adolescence. With psychopathy, developmental history may include early conduct problems, callous unemotional traits, aggression, deceitfulness, shallow affect, poor behavioral control, or lack of concern after harming others. For example, a person may show a long-standing pattern of cruelty, manipulation, and emotional detachment beginning early in life. But psychopathy itself is not the same thing as a DSM diagnosis. With sociopathy, people sometimes use the term to imply that a person became antisocial because of their environment, adversity, trauma, social learning, or instability, but this is not a formal diagnostic rule. For example, someone may say, psychopaths are born, sociopaths are made. That phrase is common online, but it is oversimplified. Real development is more complex than that. With NPD, developmental pathways are also complex. Clinically, people often discuss possible contributions such as excessive criticism, excessive overvaluation, emotional invalidation, attachment disruption, shame dynamics, temperament, family environments, or inconsistent mirroring. But there is no single pathway that produces NPD. For example, one person may learn to maintain self-worth through achievement and superiority. Another may learn to protect against shame by appearing invulnerable. Another may become dependent on admiration because ordinary self-esteem was never stable. So, developmentally, ASPD has a specific conduct disorder requirement. Psychopathy may involve early callous unemotional or conduct-related traits. Sociopathy is often used to imply environmental causation, but imprecisely. NPD may involve developmental patterns around shame, validation, overvaluation, invalidation, and self-esteem regulation. Chapter 16, Common Public Misuse. This is one of the most important parts of the video because these terms are constantly misused. ASPD is often misused for anyone who is rude, rebellious, criminal, selfish, cold, or emotionally unavailable. For example, someone may say, he is antisocial because he does not like parties. That is inaccurate. In everyday language, antisocial sometimes means socially withdrawn, but clinically, antisocial does not mean introverted. It means a pattern of violating others' rights and social norms. Psychopathy is often misused for anyone who seems scary, violent, unemotional, charming, or cruel. For example, someone may assume a calm person after a breakup is a psychopath, but emotional composure alone does not equal psychopathy. Sociopathy is often used as a synonym for bad person, toxic ex, manipulator, or person who hurt me. For example, someone may label a former partner as a sociopath after a painful relationship. The harm may be real, but the label may not be clinically meaningful. NPD is often misused for anyone who is selfish, arrogant, vain, confident, immature, or active on social media. For example, calling someone a narcissist because they post selfies, enjoy attention, or talk about themselves too much is not clinically sufficient. NPD is not ordinary vanity. It is a pervasive personality pattern involving grandiosity, admiration, entitlement, impaired empathy, and interpersonal dysfunction. The point is not to say that these labels are never relevant. Sometimes they are. The point is that they require pattern, duration, impairment, and careful assessment. Chapter 19. Why this matters. So, why does any of this matter? Well, it matters because labels shape how people understand behavior. If every harmful person is called a narcissist, then narcissism becomes a synonym for person who hurt me. If every manipulative person is called a psychopath, then psychopathy becomes a synonym for scary person. If every volatile person is called a sociopath, then sociopathy becomes a vague insult. If every person who breaks rules is labeled as ASPD, we miss the developmental and diagnostic specificity of the actual disorder. At the same time, being careful with language does not mean excusing harm. Someone does not need a diagnosis for their behavior to be damaging. A person can be manipulative without having NPD. A person can be cruel without having ASPD. A person can be emotionally abusive without being a psychopath. A person can be dangerous without fitting into a neat clinical category. And a person can have a diagnosis and still be responsible for their behavior. Clinical accuracy and accountability can exist together. Chapter 20. Practical takeaway for viewers. If you're trying to understand someone's behavior, instead of immediately asking, are they a narcissist, a sociopath, or a psychopath, it may be more useful to ask, do they show a repeated pattern of violating boundaries or rights? Do they take accountability when they harm others? Do they show remorse that leads to changed behavior? Do they manipulate people for gain, admiration, control, or avoidance of shame? Do they become aggressive when criticized? Do they use people instrumentally? Do they show empathy when it costs them something? Do they respect rules only when there are consequences? Do they repair harm, or do they simply manage their image? Those questions are often more useful than arguing over labels. Because in real life, what matters most is the pattern over time. Not one apology, not one bad day, not one charming moment, not one cruel moment, the pattern. Closing summary. So, to summarize, antisocial personality disorder is a formal diagnosis centered on a long-standing pattern of disregard for and violation of the rights of others. It is behaviorally focused and includes features like deceitfulness, impulsivity, aggression, irresponsibility, reckless disregard for safety, and lack of remorse. Psychopathy is not a standalone DSM diagnosis. It is a forensic and research construct involving traits such as callousness, manipulationness, shallow affect, low remorse, stimulation seeking, and often antisocial behavior. Sociopathy is not a formal clinical diagnosis. It is a popular term used consistently, often to describe antisocial, manipulative, volatile, or chronically harmful behavior. Narcissistic personality disorder is a formal diagnosis centered on grandiosity, need for admiration, entitlement, impaired empathy, and self-esteem regulation. These terms overlap, but they are not the same thing. ASPD asks, has the person repeatedly violated the rights, safety, and boundaries of others? Psychopathy asks, Is there a broader callous, manipulative, low remorse trait profile? Sociopathy asks, what does the speaker even mean by this term? NPD asks, is this pattern organized around grandiosity, admiration, entitlement, shame, and self-worth? And the final point here is the label matters, but the pattern matters more. What matters is empathy, remorse, accountability, exploitation, repair, and behavior over time. Personality language should help us understand patterns more clearly. If this video was helpful, consider liking the video, subscribing, and leaving a comment with another mental health comparison you would like me to cover. Thank you for watching, and I'll see you in the next video.